Good afternoon, and welcome to the City Club of Portland's Friday Forum. I'm Pat McCormick, President of City Club, and I'd like to welcome members and guests alike, those of you who join us today here at the Governor Hotel, and those of you listening on OPB Radio or watching on Portland Community Media. Today's City Club members will debate and vote on ballot measure 26-151. But first, some announcements. The generous support of City Club's corporate and media sponsors ensures that we put on the state's best civic programs week after week. I'd like to thank our media partners, including Oregon Business Magazine, and our Friday Forum Spring corporate sponsors, Morel Inc., Northwest Natural, and Schwabe Williamson and Wyatt. We're grateful for your support and commitment to City Club's mission. Please join me in a warm round of applause for our sponsors. I would also like to recognize and welcome one of my predecessors as president of the City Club, Judge Jack Beatty. Judge Beatty was the chair of the 1955 City Club committee that studied fluoridation of Portland's water supply. Welcome, Judge Beatty. 58 years later. Join us next week for the State of the City with Mayor Charlie Hales. The following week, Congressman Kurt Schrader will discuss immigration reform. Also, tickets are now on sale for our Spring Civic Salon series, where our provocateurs will discuss the future of Portland, everything from how we will get our news in the future to our food. Our civic salons bring people together in an intimate space for enjoyment, education, and the exchange of ideas, complete with good food and beverages. You can learn more about City Club events, purchase tickets, and become a member on our website, pdxcityclub.org. Today we will vote on the adoption of a newly released City Club report on ballot measure 26-151, which requires Portland to fluoridate its drinking water supply at the levels recommended by the Centers for Disease Control and Prevention, or the Oregon Health Authority, and is intended to reduce tooth decay and promote oral health. This report, like all City Club reports, was written by volunteer members of the club who were carefully screened for conflicts of interest before they were appointed to serve on the study committee. The committee was charged with assisting club members and the public to better understand the implications of the measure and to recommend either a yes or no vote. City Club members now have the opportunity to discuss, debate, and vote to accept or reject the committee's recommendation. Angela Wyckoff, chair of the committee that studied Measure 26-151, was unable to join us today, so Nan Newell, committee member, will now present the report on Measure 26-151. Upon completion of her presentation, Nan will move for adoption of the report's majority recommendation. She will be followed by Michael Crean, vice chair of the committee, who will present the minority report. He will move to amend the motion by substituting the minority recommendation. The committee will then be open, the meeting here will then be open for debate and vote by City Club members. Please be reminded that it is club policy that only City Club members are allowed to participate in the debate and vote on the report. The City Club's bylaws stipulate that it is permitted for a member to substitute a minority report for a majority report. Clifford Droke will serve as parliamentarian and timekeeper for our debate today. Now I'll turn the podium over to Nan Newell and Michael Crane. Nan and Michael.
Thank you. Because of the prevalence of serious dental health issues in Portland and the proven effectiveness of water fluoridation in substantially reducing the incidence of tooth decay, your committee voted 11-1 to recommend a yes vote on the ballot measure. But first, many thanks to all the committee members, research advisors, witnesses, and Greg Wallinger of the City Club for their thoughtfulness and hard work in the past few months. I don't know how everyone felt about fluoridation when we began our research, but I do know that we all questioned our original assumptions, read extensively, listened to our witnesses, and may have changed our mind during the process. So please stand up and be recognized. On September 12, 2012, the Portland City Council passed an ordinance requiring the Portland Water Bureau to fluoridate the drinking water supply at 0.7 parts per million, the standard recommended by the nation's Centers for Disease Control. Opponents of fluoridating the public water supply succeeded in referring this ordinance to voters by petition. A yes vote on the ballot measure on May 21st will mean that Portland's water supply will be fluoridated at the recommended level, and a no vote will mean that Portland's water supply will remain unfluoridated. Portland has a substantial dental health problem that needs to be addressed. Tooth decay among children is a major concern, often causing severe pain and infection, which can in turn have negative effects on a child's education, general health, future employment, and self-esteem. Oregon children have one of the worst rates of tooth decay in the country, and untreated dental decay is the most common childhood disease in Oregon. Tooth decay would not be such a problem if adequate dental care were universally accessible. However, nationwide information shows that millions of Americans lack access to affordable dental health services. Many health insurance plans exclude dental care or require large cost sharing, and dental care is out of reach for many middle and low-income families. Portland has tried several alternatives to stem these serious dental health problems facing our community, including fluoride tablets and rinses in schools, improved access to dental care, and education about diet and nutrition. For a number of reasons, these attempts have not proven successful. In 1999, the Centers for Disease Control named water fluoridation one of the 10 greatest public health achievements of the 20th century. This conclusion was based on a multitude of studies that have shown water fluoridation to be an effective, equitable, and low-cost way to improve dental health. We were committed to studying the most complete peer-reviewed scientific literature available to separate facts from opinions and to understand why there is some controversy in interpreting some of the scientific literature. We soon learned that studies have been done with dramatically varying concentrations of fluoride in water. In some studies, these concentrations were many times higher than the proposed standard for Portland. We found that the vast preponderance of the scientific data collected over the past 65 years from around the world confirms that water fluoridation at the proposed concentration of 0.7 parts per million decreases dental decay during a lifetime with no negative health effects. Water fluoridation has also been shown to reduce dental health disparities. Racial and ethnic minorities, people with disabilities, and low-income families and elderly people are especially hard hit by the lack of access to dental care. Water fluoridation is the only practical way to reduce these disparities in the United States. At equal cost, no other program is able to achieve the benefits of fluoridation. We also considered the costs of poor dental health. Treating dental decay is expensive, both in terms of direct costs of treatment and the indirect costs related to the impact on overall health and missed educational and employment opportunities. The rate of return from investment in water fluoridation is very high. Data from the 204 million Americans currently drinking fluoridated water shows that every $1 invested in fluoridation saves $38 in dental treatment costs. The cost of implementation of water fluoridation as a preventative measure is very low compared with medical costs associated with later treatment of poor dental health. One issue we found with water fluoridation is that feeding infants less than 6 months old with formula made with fluoridated water at the proposed level on a regular basis may increase the chance of developing mild fluorosis, a cosmetic condition that is not a health threat. Most dentists and doctors agree that a low prevalence of mild fluorosis is a reasonable trade-off for a substantial reduction in dental cavities. The committee also examined environmental concerns. There are few scientific studies of environmental impacts of fluoride in water, and most of them are at least 20 years old. However, it's known that fluoride levels at greater than 0.2 parts per million adversely affect the behavior of salmon, a particularly sensitive species. Thus, the Portland Water Bureau will treat wastewater so that less than 0.2 parts per million of fluoride will enter our streams and rivers. The committee majority does not expect adverse environmental effects based on the scientific studies that have been conducted so far. When implementing public health measures, often there is involved a trade-off between social benefits and individual rights. The majority of our committee agreed, though, that in this case, the social benefits prevail. So to conclude, your committee majority believes that the need to provide Portland with a method for reducing cavities is great and would have long-term benefits for our children, our community, and our economy. While fluoridation of public drinking water in Portland does not address all issues related to access to adequate dental care and reduction of dental disease, the committee majority feels it is an effective, low-cost, and equitable way to provide dental health, and therefore recommends a yes vote on ballot measure 26-151. I move for adoption of the report.
Thank you, Dan. Michael? The minority has three major concerns with the fluoridation measure presently before us: overexposure to fluoride for some age groups, insufficient informed consent, and unavailability of economic alternatives. There are two groups in the population which are most at risk of overexposure if fluoridation is implemented: infants and children between the ages of 6 months and 7. This overexposure increases the risk of dental fluorosis, which is associated with excess fluoride ingestion. Infants who consume formula reconstituted with fluoridated water will be subject to a dose of fluoride that is almost twice the level derived from the safe reference dose established by the Environmental Protection Agency and considered to be without any deleterious effects. With respect to children between 6 months and 7 years of age, the phenomenon of overexposure is quite different. In the decade since our club last took a position on fluoridation, there has been an improved understanding of the various sources of ingested fluoride. The contribution to total ingested fluoride from beverages, food, and toothpaste is much higher than previously thought. The EPA in a 2010 report estimated that as much as 60% of the total ingested fluoride for children between 6 months and 7 years of age is from sources other than drinking water. EPA estimates that the total fluoride intake from all sources, including drinking water, will exceed their proposed safe reference dose for this age group. Presently, products containing fluoride provide an abundance of information about its risks, proper use, and benefits. Items used for topical applications such as toothpaste and rinses have detailed warnings and information on their packaging. Systemically administered fluoride products such as tablets require a prescription, which ensures informed consent in a medical setting. Fluoride tablets provided in schools require parental written consent. Current tablet programs also permit a dosage adjustment to account for a child's age and other sources of dietary fluoride. Systemically administered fluoride via the drinking water system is a one-dose-fits-all approach that does not allow dosage adjustment or provide any semblance of informed consent. Finally, if fluoridation is implemented, a large number of residents desiring to opt out will face expensive alternatives. Fluoride is a very small ion and consequently difficult to remove. One filtering system capable of reverting fluoridated water to its naturally occurring background level is reverse osmosis. The cost is considerable, estimated at $400 per install per sink and $140 per filter, making it economically difficult for many Portlanders to afford. In summary, infants and young children may be exposed to excess levels of fluoride with an increased risk of dental fluorosis. The process of delivering fluoride to the population via the drinking water system does not allow for comprehensive informed consent or dosage adjustments, which are characteristics of currently available methods. And those wanting to avoid ingesting the added fluoride in their drinking water will be burdened with expensive filtering alternatives.
Finally, I joined such prominent organizations as the Sierra Club and most recently a Nobel laureate, Dr. Arvid Carlson, in advocating a no vote on Measure 26-151. The minority also recommends adding the minority conclusions to the unanimous conclusions.
Thank you very much, Michael. Prior to today's debate, members signed up at the registration table to testify. In the interest of fairness and time, 10 members were selected at random to testify, 5 in favor of the majority report supporting the ballot measure, and 5 favoring the minority report opposing it. I will alternate between the two positions. We've tossed a coin and will first recognize a member opposing the ballot measure. Each member will have 90 seconds to testify. Clifford Droke will be helping me to rigorously enforce our 90-second rule for member comments at the microphones by flashing a 15-second warning card indicating that time is running out and by ringing a bell when the time is up. The microphone to my far right is labeled yes, and the one to my far left is labeled no. Will the following 5 members please line up behind the yes microphone? Stuart Campbell, David August, Judy Farmer, Ted Kay, and Jimmy Lindsay. And will the following 5 members please line up behind the no microphone? Don Kane, Sandra Gainey, Bill Osmundson, Dean Funk, and Casey Carla Hansen. If time permits, at the end of the conclusion of the remarks by these testifiers, additional club members may be asked to add testimony until the end of our scheduled debate time. So the first is from the no side, Don Kane. Please introduce yourself as a City Club member and then proceed with your remarks.
I'm actually a brand new City Club member, glad to be. I am wanting to vote no on this for a few different reasons. One, because I live in a very small area of Portland in a city called Maywood Park, and we don't get to vote on it even though I'll be exposed to whatever is put in the water. And I think there are a lot of points that are very important to bring out in why we shouldn't put hydrofluorosilicic acid into our water. First of all, it isn't medical grade fluoride. It's not what's put in toothpaste or rinses, and it's never been tested by any government agency in that direction. So that's a pretty good, important point. The other point that I think is most important is that, yes, underserved people do get cavities, mostly because they don't know how to properly eat and brush and floss for their oral health. And I think that educating those people will far better serve them than exposing the whole of the society to a substance that is uncontrollable. So that's my bit on it. Thank you for listening.
Okay, my name is Stuart Campbell, and I was fortunate enough to be on the Fluoridation committee. So, before I moved to Portland, I was fortunate enough to have grown up in a community with fluoridated water. I was also lucky enough to have adequate dental care. Unfortunately, many of Portland's low-income families, racial and ethnic minorities, individuals with disabilities, and the elderly are not as lucky. In America, over half of all low-income families have no access to dental care, and in this city and in this state, this statistic is even more compelling. We have one of the highest rates of tooth decay in the country, and this untreated tooth decay leads to a whole host of problems, such as childhood disease and bad overall oral health. Those hurt most by the lack of dental care are these underserved populations. Many Portlanders face considerable challenges and accessing treatment, such as little to no transportation, a lack of dental center options, and inadequate oral health education. While it's true fluoridated water is not a silver bullet and will not solve our city's dental crisis, it is proven to help decrease tooth decay. In a city that emphasizes social responsibility and healthy living, fluoridating our water is but one low-cost effort to help the least among us live healthier lives.
Hello, my name is Sandra Gainey. I'm an environmental policy specialist with an emphasis in wildlife toxicology, and I'm also raising 2 children in Portland Public Schools. And I just want to describe to you what we're proposing to do, all factual, and I do believe it will be in a history museum today, and the people of the future will look back in amazement that we did this. We're going to buy contaminated industrial waste, which is not disputed any longer, from China or Mexico, maybe Fresno, because they have a large pesticide industry and they have some of this material to get rid of. So we're going to buy contaminated industrial waste with our money. We're going to ship it here. We're going to truck it up the highway. We're going to build a chemical facility on the side of Mount Hood. We're going to pour it in the water with buffering agents because the material is so corrosive. And then by all accounts, all of it, 99% of it, all of it will be poured into the water, straight into the environment with no effect on anybody's teeth because it's down the drain, in the toilet, the shower, the laundry, the dishes, the garden hose. We know it bioaccumulates in the environment. We know it bioaccumulates in the soil. We know that it affects the brain, the glands, the soft tissue, the bones. We keep calling fluorosis cosmetic effect. It is a health effect. It is the first visible signs of fluoride toxicity. Let's talk about spills. There are 30 fluoridation spills nationwide. We have no spill response plan. No spill response plan. Thank you.
Thank you.
Good afternoon. My name's David August. I'm a City Club member, and I feel like I have a rather unique perspective that probably very few, if any of you, have in this room. I grew up in Philadelphia, and as I went to dental school in Philadelphia, I am a retired dentist. And as I was in dental school in the mid-'60s, and we brought in impoverished people, impoverished kids from North Philadelphia into our clinic to try to take care of their dental needs, and we're astounded that they didn't have any dental decay. It was about a decade after Philadelphia fluoridated its water. It was an amazing sight, and for us, we thought, oh, decay is gone. Well, fast forward 2 years later, as a newly minted dentist in the military, processing young soldiers, shipping out to Vietnam from Appalachia, from the South, and it looked like a war zone. We examined these young soldiers, and they had devastation. It was really sad to see. But that was a poor population. Then when I was in private practice in South Central Pennsylvania, no fluoridation, and there was no economic difference because we saw affluent families, poor families, everyone suffering from the decay and all the things that go with it. So I would urge all of you to do something good for future generations, for your grandchildren, your great-grandchildren, and vote yes for the ballot measure 26-151. Thank you.
And I'm a dentist. I've been a dentist for 35 years with a master's in public health. I am opposed to fluoridation. For the first 25, I was in favor. Now I'm opposed. What changed my mind was I looked at both sides of the science, not just what came out of the CDC and the American Dental Association, but both sides. It was like a knee in the gut. You've only heard one side of this story mostly. What convinced me to be opposed to fluoridation and spend more than 10,000 hours on this issue is the fact that fluoride is a highly toxic poison defined by law as a poison and exempt from poison laws as either a pesticide or a drug. So under those laws, it is regulated. Instead of going to drug laws and getting the Food and Drug Administration to approve fluoride, which they've tried many times, the FDA has said no, it's not safe and effective. But instead of going to the FDA, we're trying to vote a drug on our neighbors that's never been approved, that's the FDA, and I've been in communication with them a lot on this, have verified to me it's an unapproved drug. It's illegal. If you go to the pharmacies and you say, I want some fluoride to swallow, they're going to require you to get a prescription. If you say, is it FDA approved? They'll say no. We are not the competent people to make the decision on whether a substance is safe and effective. We aren't the pharmacologists, the epidemiologists. It's Congress who has said the FDA. All these people who want fluoridation need to do is to ask the FDA, because the FDA says it's not effective and it's not safe. Thank you for voting no.
Good afternoon. I'm Judy Farmer, a City Club member. I have to admit I have not read the complete City Club report on this issue, so most of my reasons for supporting it are from personal experience. I am of the age growing up where they didn't put fluoride in the water, and I spent many, many hours at the dentist having cavities filled. Fortunately, my parents were able to afford good dental care, so it wasn't that big of a problem for me, except the discomfort and fear of going to the dentist. My daughters now are in their early 40s, and ever since, well, since before they were born, we have lived in communities that have had fluoride in the water. They have never had a cavity, and they have not suffered any ill effects from drinking, getting fluoride in their water. So I am for the measure and will vote yes here today and on Election Day. Thank you.
Dean Funk, City Club member, Board of Governors. I'm going to read a statement from Dr. Arvid Carlson, pharmacologist and Nobel laureate in medicine and physiology in the year 2000, commenting on the City Club report on ballot measure 26151. The proponents state that an addition of fluoride to drinking water is needed to improve dental health, especially by alleviating caries. If this were true, how can one explain that dental health is no worse in countries in Europe in comparison with the United States, in spite of the fact that fluoridation of water supplies is only practiced by 3% of European population? Could a different level of economy or education explain the difference? Admittedly, such factors are important, but there's certainly no evidence to favor such an hypothesis. One argument advanced in favor of water fluoridation is that dental health has improved following the introduction of this measure in the United States. However, at the same time, a comparable degree of improvement in dental health has occurred in Europe. Probably equally improved levels of education and standard of living have played an important role in both parts of the world. A major concern, not least in the most developed parts of the world, is the growing environmental contamination of chemicals produced by the industry. The potential toxicity of these chemicals is often poorly defined, and even in cases where some evidence establishing the toxicity levels for individual chemicals are available, the very likely occurrence of potentiation, where combined effect is greater than the sum of the individual effects between different chemicals, involves health risk of gigantic dimensions beyond any reasonable standard possibilities. Hence, environmental researchers now give high priority to protecting the environment from chemicals of various kinds. In that perspective, fluoridation of water supplies stands out as an anachronism which, in fact, is already beginning to be abandoned in the interest of its citizens. I sincerely hope the introduction of this measure in Portland will be rejected. Gothenburg, April 11th, 2013.
Ted?
I'm Ted Kay, member City Club, and the focus today is appropriately on the current study. However, I'd like to remind members that we've been at this for a long time. I'm going to read an excerpt from City Club's 50th anniversary history, The Conscience of a City, published in 1966. The City Club's 1955 study of fluoridation of public water supplies for better dental health is proudly described as our best seller. Over 24,000 copies of this report, acclaimed as excellent and technically accurate, have been sent upon request throughout the United States and to foreign lands. The fluoridation, this is a quote, the fluoridation of public water supplies as a public health measure has probably been as thoroughly investigated as any public health measure ever proposed, unquote, commented the committee headed by John C. Beatty, Jr. The overwhelming weight of dental, medical, and other scientific opinion confirms fluoridation of public water supplies as a safe an economic way of cutting incidence of cavities by at least 1/2. So 58 years later, I hope we'll get it now. Thank you.
Thank you, Ted.
Good afternoon. I'm Casey Hansen. I'm a City Club member. I have no doubt that everyone in this room wants the best for our community, especially folks that are suffering from bad dental health and other health issues. However, I want to key on one specific point. The committee advocates said this: the social benefits outweigh individual rights. Let me repeat that. The social benefits outweigh the individual rights. Those individual rights are the rights of Portlanders, real people who will suffer because of fluoridation chemicals in the water, people with multiple chemical sensitivities, people that face have thyroid issues, people with autoimmune deficiencies. These people aren't some fake numbers that we can just disregard. These people face dealing with a very real problem in their health. People like ex-City Commissioner Mike Lindbergh, who has been advised by his doctor to avoid fluoride water at all possible costs. These people aren't some numbers we can shove aside. These are real people. We are being made to make an ethical decision to fluoridate the entire community, to provide sustaining water for all Portlanders, and those folks will have no opportunity to avoid it. You heard about the reverse osmosis systems. They aren't even 100% effective. We will be throwing a portion of our population under the bus. I urge you to vote no.
Good afternoon. My name is Jimmy Lindsay, City Club member and also a member of the study committee. Within the study committee, I reviewed the press around the nation concerning fluoridation and that debate nationally. I was quite surprised by the alarmist tone of the opponents of fluoridation that were very concerned and very passionate about the supposed negative health effects associated with fluoridation. After looking into the issue, it's become clear that there are no negative health effects associated with fluoridation at the levels being considered here today. The only condition that may be associated with fluoridating our water supply is mild fluorosis. And before participating on the study committee, I had never heard of mild fluorosis before, didn't know what it was, sounded a little bit scary. But while learning more about this condition, I discovered that myself, I actually, having grown up in a fluoridated community, have mild fluorosis and had never known about it until I looked into the issue a little bit more deeply. I can assure you, as a survivor of mild fluorosis, that my life has in no way negatively affected by this condition, and I encourage you strongly to vote for the measure.
Thank you to all of our presenters. We appreciate your input. Time remains for additional debate. If any members of the club, and it is open to members only, wish to speak in favor or in opposition to the proposed measures, please proceed to the appropriate microphone to be recognized, and we will give you each 90 seconds, the same as we gave to the other presenters, 90 seconds to present your point of view, and Cliff will continue to keep time on those comments. Ed?
My name is Edward Hershey. I'm a City Club member. I value the contrarian, quirky, and yes, even weird Portland way that is satirized so deftly on Portlandia. But I find that giving into alarmism, pseudoscience, and sophistry on an issue this important to the public health, and particularly our children, and particularly our children of family of limited means, is just utterly inappropriate. I commend the committee for its report, and I would like to suggest that uninformed opposition in the name of informed consent is an inappropriate response. I'm going to vote yes here today and in our ballot.
Seeing no one at the no microphone, we'll return to the yes side.
Okay. I'm Muriel Lezak, a member, and have been a member of the research committee, which has been an eye-opener. I was a fence sitter when I got on. I had no idea which way I would vote. The turning point for me was finding out that it wasn't just children that benefited, they certainly do, but having fluoride in our water system at the very low safe level that is projected provides us, our bodies, when we can ingest it, a continuous, very low-level fluoride bath of our teeth, which protects not just the kids, but the elderly, the infirm, the people who can't afford toothpaste, and unfortunately there are many of them. I want to speak to the European experience. First of all, you must know they have fluoridated salt, okay? And secondly, those countries that show good dental health, they're the countries on the western end of the continent, not including Great Britain, and they all they have notoriously bad teeth. and they all have adequate medical and dental care for all of their citizens, which we do not have here.
Thank you.
Good afternoon. My name is Lisa Creamer, and I'm a new City Club member, and thank you so much for letting me speak today. I hadn't intended to speak, but I am a mother of 2 boys. I grew up and there was fluoridation, but I still have cavities. But you made a comment, or a comment was made earlier that I had to address, and basically, if we teach people proper hygiene and provide the tools for proper hygiene, then we've taught them something for life. If you teach a man to fish, he will eat for life. By fluoridating the water, yes, we may help a little bit, but we're not helping people take care of themselves, and that's what needs to be done. The other thing is I've traveled around all of the United States, lived abroad a lot, and we have some of the best tasting water here in Portland. And I don't know if you guys have been around or had to live anywhere that has fluorination, but I have, and it's not tasty. And you think about that the next time you turn on your tap water and you take a sip of water, it doesn't taste good. So I would rather teach people to take care of their teeth correctly so that they can go forth and take care of them for a lifetime. Thank you.
Thank you.
Craig Mossback, City Club member. I just wanted to give a couple words about the importance of water fluoridation and prevention. You know, tooth decay and procedures for tooth decay are one of the biggest reasons students miss school. And there's also other special populations that are affected. My sister has gone through chemotherapy and has a worse immune system now, and she has to get her teeth cleaned twice as often because of the bacteria in the mouth. We also know that bacteria in the mouth can be harmful for mothers who are pregnant. And then also, some of you know that Beaverton started water fluoridation about 7 years ago, and there's a pediatrician in Beaverton. 7 years ago, she was taking one of her 6, 7-year-old patients into the hospital for general anesthesia to have a dentist treat them for rampant dental decay. That's now down to once a year. So these are the reasons why fluoridation is important to prevent these issues.
Mary Vogel, City Club member. I'd like to urge all of you to watch Howard Patterson's video on fluoridation. Howard Patterson is a scientist who worked for both the Xerces Society and the Soil and Water Conservation District and is now writing a book. But he's created an excellent video, both a 5-minute and a 30-minute video against fluoridation. One of the points he makes in amongst the many that have utterly convinced me that I may actually leave town if we do. I mean, if others in my city vote to fluoridate the water, is that the National Institute of Health actually commissioned a study by the University of Iowa that came up with the surprising research that, in fact, fluoridation does not, that there was no correlation between fluoridation of the drinking water and children's cavities. So, you know, I really would like you to watch that video and go to his sources and see for yourself. On the other hand, the incredible health impacts are of great concern to me.
Thank you.
Chris Smith, City Club member. As a member of the Planning and Sustainability Commission, I had the opportunity to work on the Portland Plan, and through that, learned a tremendous amount about the disparities in our community. And we do have gross disparities in our community by race, by income, by geography. And the simple fact is that large portions of our community do not have good access to medical care. So if we're simply relying on people, teaching people to care for themselves and having access to things like rinses and tablets, we have failed as a community to deliver an equal playing ground on that basis. And in fact, the benefits of this measure will go specifically to portions of the community that have tremendous disparities in healthcare and dental care, and I believe as a matter of ethics, we need to support this. Thank you.
Win Wakala, City Club member. I'm confused, but I'll probably vote no just because I have some questions. One is, I don't live in Portland. I live on Bull Mountain, but we have been getting our water from City of Portland. And I know now that we're considering not getting our water anymore from City of Portland because of issues like this. So there may be a negative financial impact on the City of Portland. Another problem I have is on forcing it on people that may have problems with it. And from what I know, it's more important to floss and things like that, and I do worry about people learning how to take care of their teeth properly. So I do have some other questions, and because I'm not quite sure, I'll probably vote no.
Kurt Webering, City Club member. When you're faced with a question in which there's conflicting opinions about what the science is, it's hard to know if you're a layperson, even if you try to track it. And that's why the City Club creates study committees. I was the chair of the research board and commissioned a number of studies, and we always got a good group of people to study it carefully, and so you have to trust that they have done their due diligence, they've looked at it carefully, and when they come up 5 times saying fluoridation is good for the public health, we should trust them that they have done what not each of us can do every time, which is to look at every single study, but that they have done enough that we should support them and have some confidence that in all of these issues, just like in global warming and stuff, there are people of goodwill and intelligence with somewhat different views, but when you get enormous number of scientists saying this is what we believe, you need to trust that that's the right conclusion.
My name is Sharon Joy, City Club member. I personally know that bad teeth can cause heart failure because I've been there, I couldn't find a dentist. But I would still oppose this particular measure because I don't believe in medication being put in the water, especially unlimited amounts of any nature. I also believe it's even possible that that type of thing can be put too much in the water on purpose to kill us all, actually, without finding out in time. But, you know, but anyway, the point being is salt, I understand. That's limited. And we have choices. But this bit of putting it in the water, not for me.
Carol Collingmore, City Club member.
As I'm sitting here listening, I'm getting really frustrated because there continues to be this correlation about poor people who perhaps you're implying they don't know how to take care of their teeth, which I feel like is nonsense and hurtful. Just because you don't have money, just because you're a person of color, just because your income doesn't match everybody else's, does not mean you don't know how to floss and you don't know how to brush. There is a difference between ingested fluoride and the fluoride you put on your teeth and your toothbrush. So I think when you have this conversation, please remember what you're saying and who you're talking to and who you potentially might be offending. Because this overall is an issue of equity. It is not about your water is better than my water, than where your water comes from. It is about what access people have in this city to what is best for them. And if we would like to continue to be the city that proclaims that we are equitable and diverse and open, then think about the people that you are not taking care of. And when you say to them, get a fluoride tablet, get a prescription, now how do you think those people are able to do that? Just ask yourself that. And if you are willing to pay for that to happen, then come on over. And if you are not, please take this most affordable route by fluoridating the water, because I have yet to hear of anybody dropping dead of fluoride poisoning in the other 48 states where this exists. Thank you.
It appears that our debate has concluded. We'll now proceed with the vote on the motion to substitute the report's minority recommendation to vote no on Measure 26-151. A simple majority vote determines whether or not the club substitutes the minority report. So we will ask members with your voting cards, please raise your voting cards if you agree with the motion to substitute the minority recommendation to vote no on 26-151. Please keep your cards raised until I can indicate to you that the count is done. This is voting no on the minority recommendation to recommend a no vote. So, in other words, the recommendation of the minority is that we vote no on the measure that will be on the ballot. If you agree with the minority report's recommendation of a no vote on the ballot measure, you're going to raise your card to vote aye on the motion to substitute the minority recommendation for the majority recommendation on the committee report. Please hold up your cards and keep them up until the vote is completed. We have tellers that are checking the numbers. Now, if you disagree with the motion to substitute the minority report and for recommending a no vote on Measure 26-151, please raise your card. Keep your cards raised until I indicate that the vote count is done. Thank you. You may put the cards down. Thank you very much for the arm exercise. The City Club of Portland has voted 31 in favor and 95 opposed against the motion to substitute the minority recommendation. We'll now return to the motion to adopt the majority report on Measure 26-151, which recommends a yes vote on the measure. A simple majority determines whether or not the club supports the report. So again, please raise your voting cards if you agree with the motion to adopt the majority report on Measure 26-151, which recommends a yes vote on the measure. Please keep your cards raised until I indicate that the vote count is completed. Thank you. You may put the cards down. And please raise your voting cards if you disagree with the motion to adopt the report on Measure 26-151, which recommends a yes vote on 26-151. Please raise your cards and keep them up. You may put the cards down. Thank you. City Club of Portland has voted 96 in favor, 19 opposed, to adopt the majority report on Measure 26-151. City Club now officially recommends a yes vote on Measure 26-151. Thank you to Nan and Michael and to their committee for all the hard work in preparing this study committee report. I'll now entertain a motion to adjourn. I hear that motion. That sounds, it's music to my ears. All those in favor say aye. Opposed? The motion passes. Please join us again next week for the State of the City with Mayor Charlie Hales. And as we close for today, please join me in offering our sincere thanks to the Ballot Measure Study Committee.